Hi, my name is Austin Yeargan. I'm an orthopedic surgeon and molecular immunobiologist. And I want to talk to you a little bit today about the elbow and some of the procedures that we do for that here in our clinic. I've become an expert in molecular immunobiologics. I've been using PRP and BMC since 2006 and wrote most of the first protocols. We've put a lot of time into developing the protocols, and we've proven that they've worked over the years. The 10X device is a device that's been built for medial epicondylitis, also known as golfer's elbow, or lateral epicondylitis, known as tennis elbow. Now, tennis elbow is seen more common in our clinic. We have a lot of tennis players, a lot of racquetball players, and even more pickleball players. And if you'll note, the lateral epicondyle is located right here on your elbow, is frequently injured, and we see a lot of patients who have pain referable to the origin of these two or three tendons that include the mobile wad of the arm. These three tendons originate on the distal humerus, which is the end of the long bone of your arm here, and are subject to tearing from the bone from what are called Sharpie's fibers. You might recall Arthur Ashe had this type of injury a long time ago, and he wore a tennis elbow strap for that, which most players or patients who come to see us have already tried and ordered online. The idea behind that is you move the tendon insertion down to that point where the strap goes across, but there's never really been any studies that show that it has any efficacy at all, either by itself or with other procedures. The 10X procedure, however, was originally designed from phaco technology for removing cataracts. It was translated to the orthopedic forum by Dr. Bernard Mori, who first introduced it for lateral epicondylitis and medial epicondylitis. He's got lots of videos online that you can see on YouTube, and we'll try to include the links below so you can see what the procedure looks like. Basically, looking at this anatomic model, the mobile wad, these three tendons, come off of the distal humerus, like I mentioned. This area here is subject to tearing, and oftentimes involves two or even three tendons. If the tendon is torn too much, it'll have to be taken to surgery and repaired open. But we rarely see that. Probably 2 out of every 100 cases that we see are patients who are amenable to fixation with the 10X. Now, just talk briefly about golfer's elbow. That occurs on the other side of the elbow, on the medial side. And you'll notice here that your funny bone is behind that, or the ulnar nerve, which controls your intrinsics of your hands and lets you do everything, your fine motor. So you really don't want to injure that nerve. That's one benefit of the 10X device, is for surgeons who aren't that familiar with the elbow, they're not going to injure that nerve because the tip of the 10X shoots out an ultrasound signal into the tissue that if it comes back as a normal signal, the device won't activate. That means that if you go into the nerve, it stops. It only activates when the tissue is degenerative. Say, for instance, you have a patient with golfer's elbow that you're able to easily visualize with ultrasound, like the Philips Lumify that we use. You simply identify that portion of the elbow. There's a hypoechoic signal where there's injury to the tendon. You make a small slit-like incision in the skin, just enough to pass the 10X device into the lesion, and then activate the foot pedal. The debridement takes about 1 minute and 20 seconds or less, and patients are typically back enjoying their recreational pursuits and vocational pursuits within 6 to 8 weeks after the procedure's been completed. So if you've got any aches in your elbow, come down and see me and we'll figure out what's causing it and what the best way to get rid of it is for good.